So the risk of acquiring COVID is probably no greater in IBD patients than in the general population. That is supported by the low numbers of infections that have been reported so far in IBD patients. But our general understanding of the way immune suppression works would suggest that the risk of getting infections is not greater. It might be the risk of bad outcomes from infection that's greater. So avoiding infection becomes all the more important. The predominant symptoms appear to be flu-like illness with fevers, headache, aches and pains, and cough as a prominent symptom. So far, we have an accumulating international database of IBD patients who've been affected by COVID, and thankfully, it shows no particularly severe outcomes, low rates of admission to intensive care units, for example, in patients with IBD compared with the general population. So for IBD patients who are taking immune suppressant medications or biological medications that work on the immune system, there doesn't appear to be an increased risk of acquiring COVID infection. But I think it would be prudent to take the same precautions or perhaps heightened precautions compared with the general population, not because of the risk of getting the infection, but because of the risk of complications from the infection. So a lot of my IBD patients are asking about how they should manage their risk of COVID infection. And my advice to them takes a couple of angles. The first of those is that it's very important they don't abruptly stop their IBD treatment, particularly if they're in remission. Their treatment is likely to be very important in maintaining that remission, and stopping their treatment puts them at risk of disease relapse, which could cause significant problems. And in particular, the last thing we need at the moment is for IBD patients to be having relapses and needing to come into our hospitals when they're so occupied with other things at the moment. The second thing I'd like to talk about to our IBD patients is about what they can do to minimise their risk of acquiring COVID in the first place. And those measures are pretty much the same as the measures that are being recommended widely for the general community. I just think that IBD patients, particularly ones on immunosuppressant medications, need to be much more aware and much more cautious about following those recommendations. A lot of our patients are really concerned about being exposed to close contacts with COVID, and whether they should then be stopping their medications to reduce their risk. I think the advice would be for most of those patients that that's not a good thing to do, because their risk of a relapse from their inflammatory bowel disease is probably greater than their risk from the infection, particularly if they take appropriate precautions about being around somebody who is infected. So I think the risk of disease relapse is the biggest problem, and patients need to avoid that and continue their IBD medications. Patients should continue their IBD medications throughout this current pandemic crisis. I think it's very important that we don't allow patients to fall into disease relapse. It's a bad thing at any time. I think it's a much worse thing when everybody is so preoccupied with other health problems. A lot of patients are concerned about having vaccinations when they're immune suppressed with medications for their IBD, related to their IBD, irrespective of their treatment, and more particularly now with the coronavirus concerns and COVID disease. And for the most part, we continue to recommend the usual vaccinations that we would recommend for all our patients. And in particular, I think flu vaccination is very important. I think it's very important that patients reduce their chance of developing illnesses that might confuse the picture. Getting influenza in coming months is going to be very difficult for people to sort out. I think a lot of patients are concerned, a lot of IBD patients are concerned about how they maintain contact with their IBD clinic or their practitioners and how they can continue to be cared for in a time of social distancing and, in fact, in a lot of cases, self-isolation. I think most IBD clinics that I'm aware of are now managing a lot of their consultation, a lot of their patient care by telephone. And as long as people are still able to get periodic blood tests where they're required and those results are available to their IBD carers, a lot of the routine care can be managed by telephone. It's a bit different, of course, if people are really sick with their IBD and they need to be physically seen to be examined. And in that case, people are going to have to travel and make themselves available to be examined and seen. But for the most part, a lot of the routine care month to month can be managed in a virtual way. It's very difficult for IBD patients and any patients with chronic illnesses to deal with their chronic illness and then have something external superimposed like COVID-19 is. There's a lot of anxiety in the community, and I certainly understand that that's going to be higher in people who already are dealing with a chronic illness. I think it's important to discuss the issues around COVID with your carers if you're an IBD patient, to make sure that you really understand what the risks are, both from your treatment and from stopping your treatment and from the infection if you're going to be exposed to it. And I think having those facts at hand can be very reassuring for people, because even if there are concerns about the risks, at least you're in the know, you have the knowledge about it. And for most people, that provides a lot of power and a lot of reassurance. It's absolutely natural for our IBD patients to have particular concerns at this time around COVID-19, but there are a couple of reassuring things I'd like to say. The first of those is that the small amount of evidence we have so far would suggest that COVID-19 infection is pretty much the same in IBD patients as it is in the general population. And although the data are very early, there are no alarming signals, even in immunosuppressed patients, about COVID-19 infection. But of course, that doesn't mean we should be less cautious about exposure. The second thing that I'd like to reassure patients about is that the factors that have been shown to reduce the risk of acquiring the infection in the general community are exactly the same things that IBD patients should be looking at. And they are things about social distancing, working from home where that's possible, rigorous hand washing, preferably with soap, and if that's not available, with alcohol-based hand rubs. Here's a real challenge for people. avoiding touching your face. When you're forced to think about it, you'll recognise it's something you do all the time. But if your hands are contaminated and you touch your face, you increase your risk of acquiring the infection. So you need to be mindful of that. And then finally, you need to be protecting those around you just as you need to be protected from those around you. So you should do the same things with cough and sneeze etiquette as is recommended for everybody else. Coughing or sneezing into your elbow, you should wear a mask if you're sick yourself, whether it's with COVID or some other respiratory illness, to prevent spread of that infection elsewhere. Now, most of that is in some ways good news because it's well known to people, and I think people are increasingly coming to grips with those things and managing them. And it's no different for our IBD patients.